facilities so that they can open their minds to storehouses of information at a mere click of the mouse. The hostel facilities at the campuses spell absolute comfort and provide the right ambience for self-study for the students. For an alert mind, a supple body is a must. At Vinayaka Missions University, we ensure that the students get precisely that. Our students are thoroughly encouraged in sports and cultural activities. Besides successfully participating in inter-university sports contests, our students have also excelled in cultural meets and festivals. In a world that is swiftly turning into a village, the need to be internationally aligned is most important for any student, which is the reason why Vinayaka Missions University focuses on equipping students with the edge to compete anywhere in the world. Collaborative programs with foreign universities, study abroad programs, international student exchange programs, faculty exchange programs are a few of the initiatives of the university to empower students with this global perspective.
Vision for tomorrow, the mission of today, VMU. Bringing minds together in search of endless wisdom, VMU. Building individuals to build a world, building hopes and dreams on earth at VMU. Friends to stay, VMU. Enjoyment to learn and play, showing the way ahead each day at VMU.
Vinayaka Missions University. It is where futures are built. Come and experience it.
At VMU.
In an increasingly competitive world, the future will be owned by those who are powered by knowledge and wisdom that transcends time. There is one place where such wisdom is imparted, building individuals to build the world. Welcome to Vinayaka Missions University. Started in 1981, this hub of education has its colleges located across Tamil Nadu at Salem, Chennai, Karaikal and Puducherry, even in countries like Malaysia. The university, with 27 constituent colleges, delivers cutting-edge knowledge across various disciplines. Medicine, engineering, architecture, management, health sciences, dentistry,
Dr. Alankti,
Yes, sir.
sir, now you are the host, and before ending the session, just make me the host while
Def-
leaving. है ना?
Definitely, sir. I'm
Thank you.
waiting for one more judge to join.
Sure,
We'll
sir.
start the session soon.
Sure, sir. Sure.
Ms. Safal Lakshmi, are you there?
Yes, sir.
Kindly be ready. You'll be the first presentation for today. We are waiting for the another judge to join. Very
Okay,
soon we'll be starting the session.
Okay, sir.
Hello, Dr. Prabhu sir. Dr. Prabhu sir.
Yes, sir. Yes, sir.
Sir, the other judge has not joined. We are trying to reach him over phone, as well as
Okay,
the
sir.
other delegates also. Only one participants have joined so far. We are also trying to reach them.
Okay.
May I
Okay.
request you to wait for another 2 minutes, sir?
Okay, sir. Okay. No problem.
Thank you. Thank you, sir. Hello, Karthik.
Sir,
Can you promote Swagatloki Bhattacharya to panelist?
sir, you need to make me a co-host then for that.
1 minute. We have left the meeting.
Okay. Dr. Bhattacharya, sir? I'll send the request, sir.
Can make Shanmuga Sundaram also as panelist.
Yes, sir.
Very good afternoon to one and all. Sir, Dr. Prabhu, sir.
Yes, sir.
Dr. Raj Prasad.
Yes, sir.
Sir, good afternoon.
Good afternoon, sir. Good afternoon, sir.
Sir, we are waiting for the other delegates also. Almost all of them have joined. We'll straight away get into the YRS UG category sessions today. I welcome our judge for today's YRS UG category, Dr. N. Prabhu, sir, Additional Professor of Physiology from JIPMER, Puducherry. We welcome you, sir. I also welcome Dr. Raj Prasad, Professor in the Department of Anatomy from AIIMS. We welcome you, sir, for the session.
Thank you, sir.
So before we get into the session, I'll just read out the rules for the delegates. Total session is for 7 minutes. So you'll have to present for 7 minutes, which will be followed for 2 minutes that will have the discussion. Sir, I think both the judges have received the evaluation sheet, sir.
Yes, sir.
Yes, sir. You have received, sir.
Okay, sir. Can we get into the topic, sir?
Sure, sir. We'll start.
Fine, sir. May I request Ms. Safal Lakshmi to start her presentation?
Is my screen visible, sir?
Yes, go ahead.
Good afternoon, everyone. I'm Safal Lakshmi Pasupuleti, second year medical student. I'll be presenting a case study on an adult neglected talipes equinovirus. Talipes equinovirus is a congenital deformity characterized by plantar flexion, eversion, and adduction of the foot. It occurs once in around 1,000 live births. It could be idiopathic defect, or it could be secondary to a neuromuscular condition, or it could be syndromic. Positive familial history correlates with increased susceptibility, and the in utero environmental positioning, along with vascular deformities, contributes to the development of clubfoot. In present medical literature, we've tried to find a study which satisfactorily explains the anatomical basis for the talipes equinovirus in all the different angles, but we could not find one as such. So coming to our cadaveric dissection, the 55-year-old male had right lower limb that was contracted and shortened in length with prominent muscle atrophy, and the left upper limb also had muscle wasting with absence of left pectoralis major and prominent pectoralis minor. Now coming to the right lower limb, as we can see right here, the right lower limb is much shorter in a plantar flexed position with the tendocalcaneus tightened compared to the left lower limb. We also noted the small muscle bulk of the calf with thickened extensor retinaculum, which we can see here, leading to the heightened tension of the extensor tendons that contributes to the restricted range of motion that we have seen in the right foot, passive range of motion. Coming to the fascia that we have seen on the sole of the right foot, firstly, the plantar aponeurosis. We see that the plantar aponeurosis is thick, contracted, fibrotic, and is 1 centimeter less than that on the left side. There's marked shortening of the plantar aponeurosis and this can contribute to the high arch of the clubfoot. So as we see right here, in the left foot, the plantar aponeurosis is not taut, and it is considerably longer in length compared to that on the right foot. We also see a lateral fibrous band that is superficial to the abductor digiti minimi right here. The abductor digiti minimi is atrophied on the right side compared to the prominent muscle belly on the left side, which we can appreciate here, and only becomes tendinous on insertion on the left side, whereas we can see the aponeurotic layer in association with the abductor digiti minimi on the right side. This also contributes to the inversion deformity that we have seen in the clubfoot. We also see a medial thickened fibrous sheath that is in association with the adductor hallucis. Along with that, lateral to the calcaneum, we notice a fat-filled cavity. The fat has been cleared in this picture right here that caused the clustering of vessels right here. Now, this cavity might have been formed due to the oblique calcaneo-cuboid joint formation, characteristic to this clubfoot deformity. Now, these fibrotic bands contribute to the formation of the clubfoot deformity and exaggerate it, as I've explained with the example of the plantar aponeurosis and the lateral fibrous sheath. We also see the taut and thickened long plantar ligament right here that contributed to the exaggerated lateral longitudinal arch and contributed to the rigidity and immobility of the foot. Now, this tightened long plantar ligament could have resulted as a result of the misaligned calcaneo-cuboid joint, which I pointed out. Now, coming to the muscular features, the flexor hallucis longus tendon, we can notice the flexor hallucis longus tendon right here, leading it's taut, very tightened, passing underneath the sustentaculum tali, and we see a high arch giving a bowstringing appearance at the medial longitudinal arch. Now this also plays this is also another factor contributing to the heightened medial longitudinal arch right here. If we look at the peroneus longus tendon passing underneath the cuboid onto its insertion at the base of the base of the first metatarsal, then we see that it's thickened, and we can see that it's taut as well. Now, this also contributes to the exaggerated lateral longitudinal arch. Both muscle bellies of the flexor hallucis longus and peroneus longus were noted to be atrophied. This could be due to their taut position in the clubfoot deformity that I have noted right here, and due to their inactivity due to the abnormal bony formation. We can appreciate the deep cavus arch, the cavus deformity right here, with the removal of the soft tissue. And we can appreciate the thickened, stout first and second metatarsals, the heads of which formed a major weight-bearing point in this deformity. This is because of the misaligned talocalcaneo-navicular joints and the calcaneo-cuboid joints, along with the other tendinous contributing factors and fibrous contributing factors that I've shown. The navicular was found to be inferiorly subluxated with respect to the talar head. The talar head was found to be medially deviated, which could have been due to the taut flexor hallucis longus, which passes posteriorly to the talus, exerting its effect on the medial deviation of the talus, along with the inferior displacement of the cuboid with respect to the calcaneo-cuboid joint, which could have led to the taut long plantar ligament, exaggerating the deformity further. Now, in infants, when this misaligned bones are present, until they fully ossify, they can be corrected. But in neglected club feet like this one, on full ossification, it forms an abnormal bony anatomy of the foot, leading to abnormal weight-bearing points such as this one right here, and painful callosities and bunions at the point of weight bearing.
Sorry to interrupt. Your time is up.
30 seconds more, sir. Is it okay? So it's 30 seconds more, all right, sir.
So judges.
Yes, sir.
Thank you, sir.
Okay.
Mr. Safal,
Yes, sir.
can you hear?
Yes,
Yeah.
sir.
So this is a very good cadaveric observation.
Thank you, sir.
I have some queries. Okay, can you clarify that?
Okay, sir.
So first, you have observed that there was a shortening of the right lower limb, right?
Yes, sir.
Yes.
Yes, sir.
The shortening can happen because of any abnormalities involving the femur, any fracture or dislocation of the hip joint also, right? Have
Yes,
you
sir.
checked that status of that femur and hip joint also?
Yes, sir. The thigh was not abnormal. We have seen that the tendocalcaneus was taut that led to the contracted state and atrophy of the muscle bellies. The thighs were normal.
Okay, regarding the tautness of the tendons, how have you assessed whether the tendon is taut or really taut? How to confirm? Because what is the method of preservation used for the cadaver? It's formalin embalming or any other soft embalming methods used?
Formalin, sir.
Formalin. So normally formalin embalmed cadavers will be having the tendons will be a little bit rigid, right? So how you have confirmed that in the right side it is taut?
So we have assessed the passive range of motion compared to the left side, sir. Compared to the left lower limb.
Okay, fine. So the range of movements are restricted in the right side.
Yes, sir.
Okay. So any histological studies have been done from that fibrotic bands, what we have observed on the right side?
The histological studies, sir. No, sir.
No. Okay. Any premortal history? Could you get it from the from the cadavers? Any information?
If I'm not wrong, he was a suspected case of polio, sir.
Poliomyelitis. Right?
Yes, sir.
Okay, fine. So this that is talipus deformity. Can it happen because of pressure changes when the cadaver is put in the cadaveric tanks? Is there any possibility for that?
I don't think so, sir.
Because usually if you preserve 10 or 12 cadavers in single tank, there are chances of because of the pressure the deformity can happen, right?
But the prominent muscle wasting and as such cannot occur due to
Yes. Have you observed any changes in the ligaments in the foot apart from the plantar ligaments? Any other ligaments?
No, sir. We have not found it to be significantly abnormal.
Any changes in the spring ligament?
No, sir. Not significant.
Okay, fine. Good. It's a good presentation. Thank you.
Thank you, sir.
Thank you, sir. Dr. Prabhu, sir.
Yes, sir.
Any questions?
Safal, your presentation is good, and the findings which you found from the cadaver, no, so it's good.
Thank you, sir.
Listen, what is the final purpose of this?
Sir?
What is the purpose of this? Why
Yes,
you?
sir, we have tried to find a satisfactory anatomical study that explained the entire anatomical basis for clubfoot and all the involved deformities. But as such in literature, most of them were epidemiological studies on clubfoot. A satisfactory mechanistic approach for why clubfoot was occurring in so and so set of clubfoots could not be found in our literature search. So that's it.
Okay. Sir,
Yes, sir.
from my side, no comments.
Okay, sir, fine. It was a very good presentation. Quickly, we'll go on to the next presenter for today, Mr. Swagarlakshmi Bhattacharya. Safal, you can end your session. Bhattacharya, are you there? You can start your presentation. Hello. You can start your presentation. Mr. Shanmugasundaram, are you ready?
Good afternoon, sir. He's joining right now, sir.
May I know who is this? Sri Jagadish.
Yes, sir.
So you're representing for Bhattacharya.
No, sir. Like for Shanmuga Sundaram.
Shanmugasundaram. Okay. No, we are running out of time. You should be ready as of now. Are you ready with your presentation now, Jagadish?
Yes, sir.
Okay, you can start your presentation. Dear judges, this is the fourth presenter for today. Since the other presenters are not ready, we'll go ahead with Mr. R. Sri Jagadish's presentation.
Okay.
Okay, sir.
Good afternoon. I'm R. Sri Jagdish, second year MBBS student from Velamal Medical College Research Institute, Madurai. Here to present a research topic on effect of upper limb versus lower limb versus combined exercise on pulmonary function in bicycle ergometer among young adults with central obesity. First of all, just with the background. Central obesity has emerged as one of the major health concerns, particularly among the young adults. It has profound effects on both respiratory and cardiovascular system. Just starting off with the operational definition of what is central obesity. When the distribution of adipose tissue is abnormally high surrounding the internal viscera of the abdomen, it is referred to as abdominal or central obesity. According to the World Health Organization criteria, waist circumference of more than 90 centimeter and a waist hip ratio of more than 0.90 in males are considered to be centrally obese. Now, why are we speaking about central obesity? Just look at the effects of central obesity on lung function. It causes mechanical compression of lungs as there is increased adipose tissue accumulation around the abdomen. It becomes difficult for the diaphragm to descend down and therefore causing mechanical compression, reduced lung compliance, significant reduction in ERV and FRC, increased pro-inflammatory mediators such as CRP and human necrosis alpha, which leads to airway narrowing and that leads to increased lung resistance. As you can see from this picture over here, that the macrophages that on the the adipocytes secretes leptin and other MCP such as monocyte chemoattractant protein 1, which acts on lungs and causes inflammation, which in turn reduces lung expansion. What is the effect on pulmonary function? Exercise increases respiratory muscle strength and increases the levels of interleukin 10, which is an anti-inflammatory cytokine, and also reduces levels of pro-inflammatory mediators. What is the aim of my study? It is to determine the effect of upper limb versus lower limb versus combined exercise on pulmonary function in bicycle ergometer among young adults with central obesity. My objectives are to measure the basal FVC, FEV1, FEV1% and peak expiratory flow rate values in all the subjects, and to measure FVC, FEV1, FEV1 percentage, and peak expiratory flow rate after 30 minutes of upper limb exercise on day 1, lower limb exercise on day 3, and combined upper and lower limb exercise on day 5 using bicycle ergometer on the same subjects. Then, to compare these parameter values among group A, B, C. What are the materials and method did I use? It is an interventional study design of around 30 sample size of around 30 subjects located at Exercise Physiology Lab at Department of Physiology, Velamal Medical College and Research Institute. The study population of first and second year MBBS students. Group A received only upper limb, while Group B received only lower limb exercise, while Group C received both upper and lower limb exercise. I've conducted the study for the past 3 months from September to November 2024. I've included people with young adults of a waist circumference more than 90 centimeter in males and a hip waist hip ratio of 0.90 in males, age between 18 to 21 years, and only males. The exclusion criteria are young adults diagnosed with diabetes mellitus, respiratory disorders, hypertension, and other neurological disabilities, and subjects on medications. What is my methodology? I obtained institutional ethical committee clearance and informed the first and second year medical students about my research in the class. 100 students participated voluntarily and whose waist circumference, hip circumference, and waist hip ratio are measured to assess central obesity. Only 33 students were selected, out of which 67 students are excluded. And after applying the exclusion criteria, only 30 students were assessed with central obesity and were taken to the study. Before proceeding, we taken voluntary written informed consent from the students. And what we did is we measured the pre-exercise PFT value using the spirometer, and the 30 minutes exercise was done first for the lower limb on day 1, then upper limb for day 1, lower limb for day 3, and both combined upper and lower limb for day 5. And then we have taken the post-expiratory values after each exercise. Then the values are statistically analyzed using ANOVA. Now, what we've done in the research is we have kept the work done as constant. As the work done is force into distance, force is resistance. As resistance is what is inbuilt in the machine, and therefore it is kept constant. By keeping the revolutions per minute constant to 70 RPM, we have also kept the total distance covered by them as constant. Therefore, the work done by all the subjects are kept constant. Now, moving on to the results. For upper limb, there is a significant increase in FEV1, as we can see here. And for lower limb, there isn't much any significant increase in any of the parameters or values. And for combined exercise, there was surprisingly a significant increase in almost all the values of FVC, FPV1, and peak expiratory flow rate. What could be the reason? The involvement of wide range of muscles, both the upper limb and lower limb muscles, leads to increased oxygen demand and post-exercise oxygen consumption, which leads to greater lung expansion to meet the demand of oxygen, therefore which leads to deep and frequent breaths, thereby increasing the lung function. Now, what am I concluding with this research is that upper limb exercise increased FEV1. Lower limb hadn't had much of a significant on any of the parameters, while combined exercise increased the three parameters FVC, FEV1, and peak expiratory flow rate. What might be the implications, or what am I going to do with it in future? Persons with central obesity should perform both upper and lower limb exercise to achieve better results on their lung function when compared to only upper limb or only lower limb exercise. What am I going to do with the future direction is that we might do more further research about the long-term effects of upper limb and lower limb exercise on pulmonary function test. Thank you, sir.
Thank you. Open for discussion. Judges, please. Dr. Prabhu, sir.
Yes.
So your voice is not audible.
Hello, Jagadish.
Sir?
Okay. So you have given the upper limb exercise for the day 1, again lower limb exercise, then upper limb and lower limb, right?
Yes, sir. On different days, day 1, day 3, and day 5.
Okay. Are you including the same subjects?
Yes, sir. It is performed on same subjects. Yes, sir. It is performed on same subjects, sir.
Okay. So how many means in one day? How long they did the exercise?
For 30 minutes, sir.
30 minutes. So
yes,
will it influence the PFT parameters?
Yes, sir. The duration of exercise obviously increases the influences the PFT values.
Okay, okay. So finally, you are telling the upper limb and lower limb both exercise improve the PFT, right?
Yes, sir. Combined exercise improves pulmonary function test when compared to upper limb alone or lower limb only.
Okay, good presentation.
Thank you, sir.
Jagdish, You have divided the participants into 3 groups, right?
No, sir, it was the same subjects that was like we have performed upper limb, I have taken it as group A, and we have performed only lower limb exercise, which is taken as group B, and both exercises as group C, sir. It was performed on same subjects.
Okay, same subjects on day 1, day 3, day 5, but they are classified based on the type of exercise. Okay, okay.
Yes, sir.
Good presentation.
Thank you, sir.
Thank you, Jagdish. Can we, dear judges, can we go for the next presentation?
Yes, sir.
May I request Mr. Shanmugha Sundaram to start his presentation?
Yes, sir.
Go ahead. Shanmugha Sundaram, you can start your presentation.
Sir, one minute. Sir, is my slide visible, sir?
Yes, that's clear. Yes, Shanmugha Sundaram, your
Yes.
slide is very well
So
seen.
good
Start it.
afternoon. Good afternoon to everyone. I am Shanmugha Sundaram from BMCH. Today, I would like to discuss my research topic: the impact of breathing exercise on exhaled nitric oxide level in bronchial asthma patients. So it's an interventional study. So first we have to know asthma affects over 340 million people worldwide. Asthma is responsible for 4 lakh hospitalization every year. So global economic burden of asthma is day by day increasing. Around $80 billion has been spent. So this is a recent statistics from the WHO and the European Respiratory Society. So despite these challenges, what I am going to do is on the treatment aspect, why there is a overburden. So this is where my research is going to be. So to understand that bronchial asthma is a chronic respiratory disease characterized by airway inflammation, hyperresponsiveness, and recurrent episodes of wheezing, coughing, and chest tightness and shortness of breath. So the exhaled nitric oxide, which we are calling the ENO, is a non-invasive marker of airway inflammation with normal values ranging from 5 to 20 parts per billion in a healthy individual. This is a diagram depicting how the nitric oxide is being produced by nitric oxide synthase enzyme in the respiratory epithelial cell. And during inflammatory condition, especially like asthma, it will be increased. So next, breathing exercise are conscious, deliberate techniques that promote the relaxation, improves the lung function, and enhance the overall respiratory health. These exercises include diaphragmatic breathing, pursed lip breathing, 478 breathing, and Bhastrika pranayama. Influences on autonomic nervous system, balancing sympathetic and parasympathetic branches. So it reduces the airway inflammation and enhances the respiratory muscle strength. So our study explores the effect of these breathing exercise on exhaled nitric oxide level in patients with bronchial asthma. So my aim and objective was to evaluate the impact of breathing exercise, how this will affect on exhaled nitric oxide level in bronchial asthma patients. First, to measure the basal exhaled nitric oxide level in bronchial asthma patient. Then to measure the exhaled nitric oxide level in bronchial asthma patient group A after 3 weeks of alternate breathing exercise and other breathing exercise training. Then to measure the E-nitric oxide level of bronchial asthma patient with the group B, which I have not given any intervention. Then to compare both these groups. So methodology, study population bronchial asthma patients, study type, it's an interventional study, sample size 40 participants, 20 group and 20 control. Sampling technique is simple random sampling for 3 months of study duration. And In the Department of Respiratory Medicine, we have done this. Years were controlled bronchial asthma patients with stable symptoms and receive regular treatment with minimal symptom between the exacerbation period with the exclusion criteria of smoker, other allergic diseases, pregnancy, lactation, diabetes, hypertension, and other comorbid conditions. This is the study tool. The picture depicting it's a FeNO, that is fractional exhaled nitric oxide level analyzer. This analyzer, first we have to prepare the patient. Then I place the mouthpiece. The mouth has to be placed. Then deep inhalation through the nostril has to be done. Then slowly exhalation through the mouthpiece. Then the value will be collected through the sensitizer. It will go to the machine and nitric oxide level will be measured and it will be recorded in the computer. This is our computer. I am depicting the picture. Then for accurate result, we can repeat if we want. What all the breathing exercises I have given for the patient is 5 things. First one is diaphragmatic breathing. Procedure, we have to inhale deeply through nose. Belly will rise and exhale slowly for 3 minutes. Then pursed lip breathing, inhale through the nose, exhale slowly through the pursed lip for 2 minutes. Box breathing, that is 4 counts inhalation, hold for 4 counts, then exhale for 4 counts and hold for 4 counts. So this cycle we have to do, that is box breathing. Then 4-7-8 breathing is inhale 4 counts, hold for 7 counts and exhale for 8 counts for 4 minutes time. So fifth one is Bastrika Pranayama, rapidly inhalation and exhalation through the nostrils has been done for 3 minutes. So all these 5 exercises put together, we have demonstrated to the patient and all this will come in. We have planned in such a way that exactly it will come for 15 minutes per day. So procedure. Study was conducted after obtaining institutional ethical and scientific clearance, informed consent obtained from the patients. Participants were screened for inclusion and exclusion criteria, which I have mentioned earlier. Demographic data was collected and baseline E-nitric oxide level was assessed. Then participants were assigned to intervention and control group randomly. Alternate nostril breathing exercise training to group A was provided, the 5 techniques. Then for group B, no intervention was provided. Assessment of E-nitric oxide level, after 3 weeks, they were instructed to come and we measured the nitric oxide level. So data analysis and results were compared. Statistical analysis was done using SPSS version 22 software and paired t-test applied and p-value less than 0.05 was considered as significant statistics. Here are the result. The table 1 baseline characteristics with age and sex comparatively. Then table 2, which the group A, we got a significant result after 3 weeks. There was significant decrease in E-nitric oxide level. So discussion, increase. These 5 breathing exercises will stimulate the parasympathetic nervous system, which will have an effect on decrease in the inflammatory cytokines and the tumor necrosis factor alpha. Then anti-inflammatory cytokines will be increased, which result in nitric oxide synthase level will be decreased and nitric oxide level will be reduced. So finally, exhale nitric oxide levels are decreased in our study. So conclusion, breathing exercise significantly reduces the airway inflammation in patients with bronchial asthma, as evidenced by substantial decrease in E&O levels. So future directions, conduct large-scale randomized control trial and future studies can combine E&O level with FEV1 for more accuracy. Our implication to integrate breathing exercise into existing asthma management guidelines.
Sorry to interrupt. Your time is up.
Thank you.
Dr. Prabhu, sir.
Yes. Shanmuga Sundaram.
Sir.
Are you there?
Yes, sir.
Good. Your study is good. And this one, you have given the breathing exercise, no?
Yes, sir.
How long you gave?
Sir, for per day 15 minutes, sir. For 3 weeks, we instructed to do.
Okay. So the 3 weeks, how did you monitor whether the patients are doing or not?
Sir, for monitoring, daily I gave a WhatsApp reminder message whether they are ensuring. Every week I will call the patients and how many days they did, whether they skipped the exercise or not. I will be ensuring I had all their contact number and I was doing the work.
Good. Okay. And this nitric oxide level, how that instrument, what is the name of that instrument?
Sir, fractional E nitric oxide analyzers.
Okay. Is it available in your department or in pulmonology?
Sir, in the pulmonology we are having.
Okay, good. Okay, your presentation also very good, and the study also good.
Yes, sir.
Thank you.
Thank you, sir.
Shanmu Sundaram,
Sir.
actually, this is a very good presentation, very clarity. You have just presented very nicely.
Yes, sir.
Have you asked for how much the duration, whether the patients were on treatment? Have you asked about that?
Yes, sir. I am asked about the treatment, sir. It varied, sir, from around, we have included narrow age only, we have included from 30 to 50 years. Most of the patient were lying for more than 7 to 8 years, they were on treatment, sir. So
the duration of treatment was comparable between the study group and the group without intervention?
yes, sir. Yes, sir.
Okay, the group without, you have not given access to the group. Next, have you inquired about any other history of whether they personally they are doing any breathing exercises, yoga or pranayama? Because nowadays elderly people are commonly doing, right? So
Yes,
have you
sir.
asked about that history?
Yes, sir. We asked about the history in the during the data collection itself. We asked them. Then, when they are doing regular exercise or when they are participating doing the exercise, we have excluded them, sir. Then only who are not doing or who don't know about the this breathing exercise only we included them.
Okay, once you include them, have you explained about the study to that participants? So we are going to do exercise to one group and with exercise will not be given like that. Consent have
Sir,
you
no,
obtained?
sir, we have not explained, sir, because when we explain means there will be blinding will be there. So we have not all the 40 people we have taken, then randomly only we allotted the who are control and who are study and who are doing the study only we have explained the things, sir. We have not explained how this result will be to all the person.
Okay, good.
Okay, thank you, sir.
Thank you, sir. That was a wonderful presentation. Next, we move on to a presentation by Bhattacharya. Are you ready?
Yes, sir.
Go ahead.
Yes, sir.
Go ahead.
Can you hear me?
I can hear you. Present your slide.
Okay. Sir, can you see my slide?
Yeah, your slide is clear. Go ahead.
Can I start, sir?
Start your presentation, please.
Okay. Good afternoon, respected chairpersons and everyone present here. I am Swagata Lokhi Bhattacharya, fourth year UG student from Zoram Medical College, and today I will be talking about the unilateral absence of sternocleidomastoid muscle, which is my case study. So if we talk about the sternocleidomastoid muscle, it is a key landmark that divides the cervical region into anterior and the posterior triangles. So it is related to many vital structures. It divides the lymph nodes into superficial cervical and deep cervical. Also, it is related to the heads are related to the vitreous nodes. That's why the sternocleidomastoid muscle is one of the most important muscles in the neck region. So if you talk about why this particular topic fascinated me, it's because that when I went through literature, I found that there are only around a dozen reported cases which presented with congenital unilateral agenesis of the sternocleidomastoid muscle. So I took up this topic, and though it is just an absence of this muscle, however, it has so many horizons to dive into, from embryology to genetics to the molecular level. So before we start, let's move on to the origin and insertion of this muscle. As we can see, the sternocleidomastoid muscle, It has two heads. It has a sternal head and it has a clavicular head. So the sternal head, it originates from the anterior surface of the manubrium of the sternum, and the clavicular head from the medial 1/3 of the clavicle. It goes on to insert into the lateral surface of the mastoid process and the lateral half of the superior nuchal line. And the nerve supply is from the spinal accessory nerve and the branches from anterior rami of C2 to C3. Coming on to the actions, when they act individually, they tilt the head towards the shoulder on the same side, and it can also help to rotate, to turn the face to the opposite side. And when they act together, they draw the head forwards. We should also talk about the embryology now. So when we go on to the embryology, we know that what happens is this the skeletal muscles, they are derived from the somites, and these somites, they are segmented from the paraaxial mesoderm. So these somites, they only start from the occipital somites. It started, and above that it is called as somatomeres. So somites then give rise to dermatome and sclerotome and myotome, and it is the myotome cells which differentiate into the myoblasts, and then the myoblasts are the ones responsible for the formation of skeletal muscle system. And this differentiation, it involves transcriptional factors like MYOD1. So this is the photo where the myoblasts differentiate into the skeletal muscle. But there is this interesting fact that for the cervical muscles, it is not the paraxial mesoderm, but it is found that it is actually the undivided portion of the lateral plate mesoderm, which is the source of the muscle progenitors of the dorsolateral neck muscle, that is the trapezius and muscle, sternocleidomastoid, not only in mammals, but also in cucularis birds. So this lateral plate myogenesis, it is regulated by mechanisms which control the cranial myogenesis. The connective tissue of the lateral plate derived muscle is from the cranial neural crest. But although this it doesn't, although the cranial neural crest, they do not control the early myogenesis, but they have a role in regulating the patterning of the brachiomeric muscles and the cucularis muscle. So moving on to my case, what I saw in my case was that during our routine dissection in our department of anatomy, what we found is we found unilateral absence of sternocleidomastoid muscle on the left side only in a 60-year-old male cadaver. And we dissected the specimen carefully as per Cunningham's manual to evaluate for any abnormal presentation. And we saw that the left sternocleidomastoid muscle was absent at its origin in the manubrium and sternal head of the clavicle, and it was also absent at its insertion on the mastoid process. However, we saw that the ipsilateral trapezius muscle and the contralateral sternocleidomastoid and the trapezius were all normal in their attachments and nerve supply. So there was no asymmetry or hypertrophy of other muscles in the neck, and there were no signs of surgical intervention on the left side. There was no remnants of the muscle which were seen, and the left lung was normal in its position. So this is the case that we found, that we can see that there is a sternocleidomastoid on the right side, but on the left side it is absent. However, the other muscles and other vessels and nerves, they were all normal in its position. This is the lateral view and also the close-up view. So moving on to the discussion, why this absence is important and why we should know about it. It is because congenital absence of the skeletal muscle is very rare, and it is about only 1 in 11,000. So it was Robert Bing in 1902 who was the first one to describe this absence of skeletal muscle in a major way. And he found that the pectoralis major was the most common to be absent, followed by trapezius, and sternocleidomastoid was only around the 11th or the 12th muscle to be absent. And Canby and Cookman, they described that this absence of sternocleidomastoid and trapezius were occurred together, and there was also absence of spinal accessory nerve. So he described this in two cadavers, but in our observed case, we saw that there was only absence of sternocleidomastoid muscle, but the trapezius and spinal accessory nerve were normal. And there's also a study which associates lung herniation into the neck related to the absence of sternocleidomastoid, but in our case, the lung was not herniated and it was normal. So we also know that why this congenital absence of sternocleidomastoid is important. It's because this absence can cause torticollis, and congenital muscular torticollis is common. It could also be due to some traumatic delivery or some other case, but this absence of sternocleidomastoid muscle could be one of the cause. Then this congenital absence of sternocleidomastoid muscle is rare, and it presents as torticollis, and there is asymmetry in the cervical region. So when there's asymmetry in the cervical region, what we can do is we can use MRI, which is a useful modality to identify this absence and to
Sorry to
rectify it.
interrupt.
So
It's time up.
hello.
It's time up. It's time up.
Okay, this is the myogenic regulatory factors which act and which the signaling is affected, and then it leads to the absence. And my conclusion is that since there is an absence of sternocleidomastoid muscle, it has so many associations as already viewed. So I just want to emphasize that in our case it was asymptomatic, but I just want to know that since it is about unveiling the future, what other factors could be responsible for neck asymmetry other than this, because in our case we found that it is asymptomatic. And about the association also, what common factors could be responsible for these associations at the molecular level. These are my references. Thank you.
Thank you. That was a wonderful observation, Ms. Bhattacharya. Actually, previous studies have associated with the absence of sternocleidomastoid with commonly associated with the absence of trapezius muscle. And some of the studies are also showing saying that there will be unilateral cerebellar hypoplasia, right? Have you checked for that? Any association in this cadaver?
Sir, in this cadaver, we did not find any association.
Did not find any association. Fine.
Yes, sir. So
Have you
that's why.
observed? Yes.
That's why our case was totally, there was no neck asymmetry. It was totally asymptomatic. And there was only one case in literature which was asymptomatic associated with squamous cell carcinoma of the tongue. And they found it only when they were operating for squamous cell carcinoma of the tongue. That was one of the asymptomatic cases in the past.
Okay. So the carotid sheath and the contents were normal in the absent side?
Yes, sir.
So is there any change in the course of spinal accessory now, the unilateral side that it's
So
affected side?
it was not present near the sternocleidomastoid muscle, but it was innervating the trapezius, and it was normal near the trapezius side.
That means its exit from the cranium, is it normal?
Yes, sir.
Okay. So what may be the clinical implications for this congenital absence of unilateral absence of sternocleidomastoid?
So the clinical implications are that if there is absence like in the pediatric age group, then it can lead to torticollis, as already said. It can lead to the lung herniation, and this is important because pediatric surgeons, when a child presents with torticollis, though there are so many common causes for torticollis, congenital absence of sternocleidomastoid must be one of our differential diagnosis, because in the past there's one case where they did not think of this diagnosis. That's why they have not come to the diagnosis even after 1 year. It was around in 2016. So this should also be one of our differential diagnosis in the same.
Okay, fine. The contralateral side, trapezius and sternocleidomastoid was normal. There was no any
Yes, sir.
shortening
The
also.
contralateral side was normal.
Okay, have you compared the size and length of the trapezius muscles on both sides?
So we compared the size, and on both sides, the trapezius, we compared it with the vernier calipers, and it was both same on both sides. The size was same of the trapezius on both sides, almost same.
Okay. The course of external jugular vein was also normal, right? Both sides?
Sir, yes?
Course of external jugular vein on both sides.
Sir, it was normal.
Have you observed that? Because external jugular vein will be passing over the sternocleidomastoid, right?
So,
Have you observed any difference in the course of that in both sides?
so there was no difference in the course of the external jugular vein.
Okay, thank you. Good, very good
Yes.
presentation.
Thank you, sir.
Bhattacharya.
Yes, sir.
Your presentation is good and the findings which you did know, so that also good. Otherwise, no other comments from my side. Thank
Okay,
you.
sir. Yes, sir.
Thank you. Next, we'll move on to the next presenter for today, Mr. Sanjay.
Yes, sir. Can you hear me, sir?
I can hear you.
Yes.
Your slides are visible. Go ahead.
Sir. Good morning, sir. Good morning, everyone. I'm Sanjay. I'm a second MBA student at Velamma Medical College, and today I'm excited to share my topic: effectiveness of breathing exercises and meditation as a mode of therapy for maladaptive daydreaming. So, what is maladaptive daydreaming? It is a psychological condition characterized by excessive emotion in daydreaming. Daydreaming can be considered maladaptive when it interferes with a regular day-to-day function, consumes too much of our time, and when it evokes a feeling of shame or guilt and causes emotional distress to the patient. And this is the operational definition as given by previous studies conducted. And so, why does daydreaming occur? The most common causes of daydreaming are avoidance, escapism, boredom, loneliness, large life changes. And other severe causes can include childhood trauma, including physical, emotional, and sexual abuse, and other dissociative pathologies. It could also occur as a side effect of other psychiatric conditions like depression. So, going into the pathophysiology, an important component of maladaptive daydreaming is the default mode network in our brain. It is a network of interacting brain regions, including the posterior cingulate cortex, anterior cingulate cortex, and a ventral prefrontal cortex. This part of our brain is active when we self-reflect, worry, or daydream, and it is usually inactive when we are focused on a particular work or external stimulus. And in a study conducted by Brewer et al., that scanned the brains of experienced meditators, they showed less DMN activation and reported less mind wandering during meditation. Therefore, I hypothesized that meditation could potentially help treat patients with maladaptive daydreaming. And pranayama was also included in my study as it is a common exercise that improves autonomic balance. And on to my aims and objectives of the study. The main aim of my study is to check the effectiveness of breathing exercises and meditation as an intervention for maladaptive daydreaming. And my objectives are to assess the severity of daydreaming among participants using my questionnaire, to implement a routine program of breathing exercises and meditation in the study group for a period of 3 weeks, to measure the post-interventional changes in frequency and intensity of maladaptive daydreaming, and to compare the study and control group after 3 weeks. Materials and methods. My sample size was 50 males from first and second MBBS students, 25 members each in control group and study group. My study design is an interventional study, and it was the location was yoga room in Department of Physiology, Velamma Medical College. And my study duration was for 2 months, ranging from September 24 to November 2024. I included male students diagnosed with maladaptive daydreaming under the SCIMD scale, aged between 18 to 22 years, and I excluded students diagnosed with other psychiatric conditions who are undergoing treatment for maladaptive daydreaming, and people diagnosed with pre-existing neurological disorders, and students on antidepressants, antipsychotics, and other drugs. So, selection of participants. I distributed a survey form among first and second year MBBS students, and I received 272 out of 300 responses. And from the scale, I took out 128 students who had symptoms of maladaptive daydreaming, and females were excluded from the study, and exclusion criteria was applied, and 50 members were remaining who were included in my study. And they were split into control group and study group with 25 students each, who are both diagnosed with maladaptive daydreaming. Methodology. I first obtained ethical committee clearance and informed voluntary consent from all the participating members, and they were instructed to perform 15 minutes of pranayama and mindfulness meditation regularly at 4:30 p.m. The subjects are assessed for a duration of 3 weeks, and after the study, they were analyzed once again with the same questionnaire, with the re-evaluation of MD as my primary outcome. And the data was input in Microsoft Excel and analyzed using SPSS software,
And the study was results were analyzed using paired t-test to obtain results. My study tool was the SCIMD scale. It was created by Professor Somner. It is a 16 question scale used by doctors to assess whether the patient is engaging in maladaptive daydreaming. It mainly talks about daydreaming triggers, physical signs that accompany daydreaming, and the feeling of daydreaming and the effect of interruptions and other factors. The scoring ranges from 0 to 10 for each question, with 160 as the maximum score. Students with a score more than 64 can be considered maladaptive daydreamers. So, method of study. The subjects are instructed to perform alternate nostril breathing exercises, that is pranayama, for 15 minutes at a pace of 6 breaths per minute. And mindfulness meditation, I made them follow an audio recording from a professional instructor who guided them through the steps of meditation for a duration of 15 minutes. And these were my results. Before intervention, the scale score was around 90.16 for the study group. And after intervention, it dropped down significantly to 80.2. And the PAR t-test value, p-value was found to be significant. While the t-test PAR p-value was insignificant in the control group. So discussion. Meditation, especially mindfulness meditation, has shown to influence the activity of our default mode network. And study using functional magnetic resonance imaging have demonstrated that regular meditation can reduce the hyperactivity of our default mode network, which is implicated in mind wandering and daydreaming. And therefore, by enhancing our ability to sustain focused attention, meditation strengthens the control networks, especially the frontoparietal network, which leads to a reduction in the frequency of our daydreaming episodes. And my conclusion, lesser frequency and intensity of daydreaming episodes were observed in people who are practicing meditation and breathing exercises. The limitations of my study are that older age group was not included, females were not included due to practical difficulties, and people with severe cases of maladaptive daydreaming were not available for my study. The implications of my study are the benefits of traditional breathing practices and meditation for enhancing cognitive functions, and neurorehabilitation through meditation in psychiatric patients. And my future direction is to assess both male and female patients for maladaptive daydreaming, to include members from varying age groups, and also to check the effects of meditation and pranayama on patients with severe maladaptive daydreaming, and to increase the study population for my study. These are my references. And this is the scale that I have used for analyzing my study group. Thank you.
You're rightly completed in time. Over to judges.
Sanjay,
Sir?
that questionnaire you, what is the name of that questionnaire?
SCIMD questions. Yes, sir.
What is the expansion of that?
It is a structured clinical questionnaire for maladaptive daydreaming.
That question is, how much is that validation? When is it approved?
So totally there are 16 questions in my questionnaire, sir.
No, that questionnaire is valid one or not? Means already it is approved.
Valid questionnaire, sir.
Okay. So your study participants.
Sir? Sir, your voice is not audible, sir.
Dr. Prabhu, sir? Dr. Prabhu, sir? I think there is some technical issue.
Okay, sir.
Dr. Raj Prasad, sir?
Yes, sir. Sanjay, actually, this study is conducted with the students, right?
Yes, sir.
Have you asked about the sleeping habits of the students, those who are participating in the study?
Yes, sir. People from my study have mostly have usual sleeping habits, but it has varied, sir, because of their own academic obligations. So sleep was not one of my criteria during my study.
Can the improper sleeping habits, can it cause daydreaming?
Yes, sir. It can cause daydreaming, but over the long duration of time, I don't think it will significantly affect the results of my studies, sir.
Okay, good presentation.
Thank you, sir.
I think Dr. Prabhu has left the meet, sir, due to some technical issue. That was a very good presentation. I think
Thank you, sir.
all the delegates have completed their presentation, sir.
Okay, sir.
Sir, you can fill up the evaluation sheet and send it to us, sir.
Yes, sir. Sure, sir. Sure, sir. I'll send. Thank you, sir.
Thank you, sir. Thank you. I thank all the delegates for joining today. Thank you. Wonderful. Mr. Karthik? Mr. Karthik?
Yes, sir.
I think the OIR session is completed, sir.
Okay, so you can make me the host, sir.
1 minute, sir. Actually, who is tech team? It has
Who
been.
is- that's our team only, sir.
Oh, it
Acha,
has
they
been
have
named
become the
as
host.
host.
ठीक है, sir.
Yes, sir, yes.
That's okay. That's okay. If
Okay,
you want
sir,
to leave,
fine.
then you can. And sir, then, but we would be needing the
For
proceedings for the
validity.
next sessions. Yes, sir.
Yes, sir.
है ना? So that's okay, sir. You can leave. That's okay. Thank
Okay,
you.
thank
We are
you.
here.
Thank you.
Homeopathy. Nursing. In an increasingly competitive world, the future will be owned by those who are powered by knowledge and wisdom that transcends time. There is one place where such wisdom is imparted, building individuals to build the world. Welcome to Vinayaka Missions University. Started in 1981, this hub of education has its colleges located across Tamil Nadu at Salem, Chennai, Karaikal and Puducherry, even in countries like Malaysia. The university, with 27 constituent colleges, delivers cutting-edge knowledge across various disciplines. Medicine, engineering, architecture, management, health sciences, dentistry, measuring up to 135 courses of study, all covered across sprawling and student-friendly campuses. At Vinayaka Missions University, students of various disciplines hone their knowledge right up to doctoral levels. At any given point, there are 15,000 students studying in the campuses. With the vision of creating medical professionals who can meet the needs of the Indian and international communities, Vinayaka Missions University has made a significant contribution to the field of medicine. Four colleges and hospitals in Salem, Karaikal and Puducherry not only groom students into medical professionals, but also ensure easy and
Karthik? M&M team, somebody please respond.
Yes, ma'am. Karthik here.
Please run the video.
Okay, ma'am. Okay, ma'am.
Please. In 10 minutes, we'll be starting, but please, till then, please run the video, please.
But ma'am, any specific plan on which we have to follow? Or
Nothing.
you'll-
Just be with us. Okay.
All
to
right, ma'am.
end, only the national anthem from your side. The others we'll be sharing from here.
All right, ma'am.
Okay.
ma'am. Then.
Okay.
After video.
Karthik, please make Dr. Frank the co-host.
Yes, ma'am.
Okay.
In an increasingly competitive world, the future will be owned by those who are powered by knowledge and wisdom that transcends time. There is one place where such wisdom is imparted, building individuals to build the world. Welcome to Vinayaka Missions University. Started in 1981, this hub of education has its colleges located across Tamil Nadu at Salem, Chennai, Karaikal and Puducherry, even in countries like Malaysia. The university, with 27 constituent colleges, delivers cutting-edge knowledge across various disciplines. Medicine, engineering, architecture, management,
Ma'am,
health sciences, dentistry,
Dr. Manju.
measuring up to 135 courses of study, all covered across sprawling and student-friendly campuses.
Dr. Manju.
At Vinayaka Missions University, students of various disciplines hone their knowledge right up to doctoral levels. At any given point, there are 15,000 students studying in the campuses. With the vision of creating medical professionals who can meet the needs of the Indian and international communities, Vinayaka Missions University has made a significant contribution to the field of medicine. Four colleges and hospitals in Salem, Karaikal and Puducherry not only groom students into medical professionals, but also ensure easy and affordable medical help to the local population. Beyond medicine, the university is a multicultural hub that has students gaining expertise in a wide range of fields. Our engineering courses are designed to give students comprehensive knowledge in all contemporary fields of study. This is strengthened by state-of-the-art infrastructure. engineering and technology apart, Vinayaka Missions University is known for its courses in dentistry, pharmacy, homeopathy, nursing, allied health sciences, physiotherapy, architecture, arts and science, and management. Vinayaka Missions University relentlessly ensures that the students get the best in the world. Our libraries are well appointed and are a digital and physical resource for both students and faculty. Linked to the central online catalogue, students have access to over 1,45,000 books, 1,000 journals, and over 5,000 audiovisual aids. All the campuses are fully networked, providing students with Wi-Fi facilities so that they can open their minds to storehouses of information at a mere click of the mouse. The hostel facilities at the campuses spell absolute comfort and provide the right ambience for self-study for the students. For an alert mind, a supple body is a must. At Vinayaka Missions University, we ensure that the students get precisely that. Our students are thoroughly encouraged in sports and cultural activities. Besides successfully participating in inter-university sports contests, our students have also excelled in cultural meets and festivals. In a world that is swiftly turning into a village, the need to be internationally aligned is most important for any student, which is the reason why Vinayaka Missions University focuses on equipping students with the edge to compete anywhere in the world. Collaborative programs with foreign universities, study abroad programs, international student exchange programs, faculty exchange programs are a few of the initiatives of the university to empower students with this global perspective.
Vision for tomorrow, the mission of today. VMU. Bringing minds together building individuals to build a world, building hopes and dreams unheard at BMU. Friends to stay, BMU. Enjoyment to learn and play, showing the way ahead each day at BMU.
Vinayaka Missions University. It is where futures are built. Come and experience it. In an increasingly competitive world, the future will be owned by those who are powered by knowledge and wisdom that transcends time. There is one place where such wisdom is imparted, building individuals to build the world. Welcome to Vinayaka Missions University. Started in 1981, this hub of education has its colleges located across Tamil Nadu at Salem, Chennai, Karaikal and Puducherry, even in countries like Malaysia. The university, with 27 constituent colleges, delivers cutting-edge knowledge across various disciplines. Medicine, engineering, architecture, management, health sciences, dentistry, measuring up to 135 courses of study, all covered across sprawling and student-friendly campuses. At Vinayaka Missions University, students of various disciplines hone their knowledge right up to doctoral levels. At any given point, there are 15,000 students studying in the campuses. With the vision of creating medical professionals who can meet the needs of the Indian and international communities, Vinayaka Missions University has made a significant contribution to the field of medicine. Four colleges and hospitals in Salem, Karaikal and Puducherry not only groom students into medical professionals, but also ensure easy and affordable medical help to the local population.
Hello.
Yes, ma'am.
Karthik,
Yes, ma'am.
in 5
Ma'am.
minutes, okay. Till actually, there's a small delay. 5 minutes will be ready.
That's okay, ma'am. Let us know when to switch off the video so we will.
Sure.
Right, ma'am.
I'll tell you.
आफ्ताब अभी चलने दो वीडियो, अभी चलने दो.
Expertise in a wide range of fields. Our engineering courses are designed to give students comprehensive knowledge in all contemporary fields of study. This is strengthened by state-of-the-art infrastructure. engineering and technology apart, Vinayaka Missions University is known for its courses in dentistry, pharmacy, homeopathy, nursing, allied health sciences, physiotherapy, architecture, arts and science, and management. Vinayaka Missions University relentlessly ensures that the students get the best in the world. Our libraries are well appointed and are a digital and physical resource for both students and faculty. Linked to the central online catalogue, students have access to over 145,000 books, 1,000 journals, and over 5,000 audiovisual aids. All the campuses are fully networked, providing students with Wi-Fi facilities so that they can open their minds to storehouses of information at a mere click of the mouse. The hostel facilities at the campuses spell absolute comfort and provide the right ambience for self-study for the students. For an alert mind, a supple body is a must. At Vinayaka Missions University, we ensure that the students get precisely that. Our students are thoroughly encouraged in sports and cultural activities. Besides successfully participating in inter-university sports contests, our students have also excelled in cultural meets and festivals. In a world that is swiftly turning into a village, the need to be internationally aligned is most important for any student, which is the reason why Vinayaka Missions University focuses on equipping students with the edge to compete anywhere in the world. Collaborative programs with foreign universities, study abroad programs, international student exchange programs, faculty exchange programs are a few of the initiatives of the university to empower students with this global perspective.
Vision for tomorrow, the mission of today. VMU, Vinayaka Mission, bringing minds together
Vinayaka Missions University. It is where futures are built. Come and experience it. Building individuals to build the world. Welcome to Vinayaka Missions University. Started in 1981, this hub of education has its colleges located across Tamil Nadu at Salem, Chennai, Karaikal and Puducherry, even in countries like Malaysia. The university, with 27 constituent colleges, delivers cutting-edge knowledge across various disciplines. Medicine, engineering, architecture, management, health sciences, dentistry, measuring up to 135 courses of study, all covered across sprawling and student-friendly campuses. At Vinayaka Missions University, students of various disciplines hone their knowledge right up to doctoral levels. At any given point, there are 15,000 students studying in the campuses. With the vision of creating medical professionals who can meet the needs of the Indian and international communities, Vinayaka Missions University has made a significant contribution to the field of medicine. Four colleges and hospitals in Salem, Karaikal and Puducherry not only groom students into medical professionals, but also ensure easy and affordable medical help to the local population. Beyond medicine, the university is a multicultural hub that has students gaining expertise in a wide range of fields. Our engineering courses are designed to give students comprehensive knowledge in all contemporary fields of study. This is strengthened by state-of-the-art infrastructure.
Good evening, all. Good evening, one and all who have gathered here virtually on this platform for this fifth international e-conference of BMSECON, Basic Medical Sciences Conferences of 2024, which was organized by the Departments of Anatomy, Physiology, and Biochemistry of Arupade Medical College, Pondicherry, under Vinayaka Mission Universities. We have successfully completed this conference of December 4, 5, and 6 with a lot of supports, with a lot of hurdles, with the blessings of the Almighty, and with a lot of mentorship from our seniors. Our conference started and ended up on a very high note this past 3 days. The people who have joined us here virtually would know the difficulties and the hurdles which they have faced during this cyclone effects and the post effects of the cyclone to have this conference, but still we have successfully conducted this conference of BMSECON 2024 without any hassle. The future belongs to those who believe in the beauty of their dreams. A quote by Theodore Roosevelt. I think the theme of our conference, which was unveiling the future of basic medical sciences as a global perspective, I think this quote goes well with the theme, and I think we have believed in it, and then the beauty of our dreams has laid down as a pure success of this conference. And I'm very happy to happen this and to be a part of MC. I, Dr. Frank Umanath, Associate Professor Physiology of AVMC, the host and MC for this valedictory function. Now, I would like to invite the organizing chairperson, Dr. M. Gopinath, Professor and Head Department of Physiology, Aripalli Medical College, to have the welcome address for this valedictory function. Sir, over to you.
Thank you, Dr. Frank. With the divine blessings of our founder chairman, Dr. A. Shanmugh Sundaram, and with the benevolent support from our Chancellor and Madam Chancellor, I, Dr. M. Gopinath, Professor and Head of Physiology, Organizing Chairperson BMSECON, on behalf of our organizing team AVMC, it is both an honor and privilege to welcome you all to this valedictory function of the 5th International E-Conference on the theme, Unveiling the Future of Basic Medical Sciences, a Global Perspective. As we draw the curtains on this enriching event, it is a moment of reflection and celebration. For this event, I invite our esteemed guests, distinguished speakers, respected faculty, dear colleagues, and fellow participants, undergraduates and postgraduates to this valedictory function. I invite our beloved Dean, Dr. Rakesh Sehgal, our Dean HP, Dr. V.N. Mahalakshmi ma'am, Dr. Sarman Singh, Director of Medical Research, Dr. Damodaran, Medical Superintendent, Dr. Rajan, Vice Principal Admin, Dr. Lata, VP Academics, and Dr. Lakshmi Jatia, Vice Principal Student Affairs for this event. Over the course of these past 3 days, we came together on this virtual platform to share our knowledge, exchange ideas, and explore the frontiers of medical science. From groundbreaking research presentations to insightful discussions, this conference has provided us with a unique platform to bridge gaps between theory and practice in the field of both basic and clinical medical science. I'd like to take this opportunity to express my sincere gratitude to each one of you, our distinguished speakers, for their thought-provoking presentations, our participants for their keen engagement and contributions throughout the event, and our organizing team for their tireless efforts. This conference has not only enhanced our understanding of the basic principles, but also has inspired many future researchers and innovative ideas. As we conclude this conference today, I encourage each one of you to carry forward the insights, ideas, and partnerships that you have gained here, and ultimately, which can contribute the betterment of the healthcare worldwide. So with that, I'd like to invite our esteemed dignitaries, speakers, and everyone to this valedictory function to share their final thoughts and feedback as we wrap up this remarkable conference. Thank you. Over to you, Doctor.
Thank you, sir. Thank you for this beautiful welcome address, sir. There is no failure when we do something, there is only feedback. I think our mentors would accept it with a gracious smile on that note. I think, and also they are the one who told me this. Criticism is like rain, and it should be gentle enough to nourish a man's growth without destroying his roots. So we are going back to the feedback for this 3 days of e-conference. I would like to welcome a few of the resource persons, chairpersons, and delegates to share the feedback. We have received a number of feedbacks, very enthusiastic feedbacks from many people. Rather than choosing it to display, we have requested them to come in person to address the gathering here. So I would request one after the other to unmute themselves and to introduce themselves and then to give the feedback about this session. I would request Dr. Ramudraj, sir, who's one of the chairperson for the session. Sir.
Thank you, Dr. Frank. Thank you for giving me this opportunity to. Am I audible?
Yes, sir, you are.
Yes, sir. Thank you. At the outset, I would like to thank immensely the organizers of this wonderful program, BMSECON 2024. And this is the 5th year you people are conducting it, and you have conducted excellently well. So, all my congratulations for this great achievement, in spite of the fact that there has been so many hurdles and natural calamities. Anyway, you have done it really well, and definitely it is a time for celebration. There is no doubt about it. And the thing is, as a participant, what I really felt is you people have selected the topic so nicely. I mean, though it is basically a conference, so ultimately, as per the Boyer's model of scholarship, you have touched upon very nicely the scholarship of integration. But being it to take topics from core areas of anatomy, physiology, and biochemistry, as well as to take research topics which has got immense translational potential, as well as taking topics from medical education, you have touched upon all the scholarly activity what Ernest Boyer has put forth. That is integration, and that is basic sciences, that is discovery, and then you people have done teaching learning as well as translational research. So in this, I'm as a participant, it is so fulfilling and it is so satisfying. And one more important thing is, at no time I felt that I'm in an e-conference. It was so engaging like a physical conference, and all the participants, all the speakers, they kept their time very nicely. And it was a seamless execution, absolutely. If there are some 10 different departments which are taking care of this BMSECON, everybody have excelled, so that the program was so nice. And as a participant, I never felt that I was sitting in a e-conference. I always felt that I'm in an actual physical conference. So that is important thing that I would like to tell to you. I was thinking again and again, because I'll be failing in my duty if I don't give you the scope to improve. But I'm sorry to say, even after multiple pondering, I am yet to find anything. But only thing is I can request to you people is that please continue this good work. This is an excellent work that you people are doing. You people are contributing like anything for the academia. And this is really good, and many of the topics are eye-opening, and it is so much motivating for the others also to get into such kind of scholarly activity. That is all from my side, and again, thank you people again one more time, and please keep up this good work. Thank you very much.
Thank you, sir. Thank you so much. Now, can I request one of the delegate, Dr. Niranjan?
Yes, sir, I am here.
Yes, can you please give your feedback?
Yes, sir, sure. I have, like Amudaraj said, he has covered almost every point. I have attended the conference all 3 days and didn't miss a single scientific session. A wide variety. Yes. Okay. A wide variety of topics were covered, all of which are highly relevant. Starting from Bernali Das ma'am, followed by Parthiban sir, highlighting the importance of AI. Then Professor Dr. G.P. Pal sir showing us the way to how to do research, even when the current resources that are available to our generation were not available to him. But in spite of that, he has done an excellent research, being an inspiration to us. And then there is excellent talk on the day 3 about inflammasomes by Kushpreet Kaur ma'am, and finally mRNA epigenetics cross-tracks by Vidya ma'am. All the excellent other topics were also very, very excellent, and all the speakers were outstanding, bringing their to every presentation and engaging the audience very effectively. And one more thing is that the conference excelled in time management, especially. The session started and ended as scheduled, so that a smooth, uninterrupted flow occurred, and due to which all topics were covered adequately without any rush. And there were ample amounts of networking opportunities. Breaks were perfectly timed. All the doubts that were asked during the sessions were explained very well. And finally coming to the pillars of any conference, the registration committee, starting from registration to the attendance, everything, the logistics were seamless. The technical support team was always available to assist, due to which the online platform was very user friendly actually, and it was very easy to navigate. And like Amudra sir said, it really gave us a physical experience. Like we were almost there, the virtual reality presence. That was the best thing. That is a fun fact, but that also matters. And overall, I had a remarkable experience. The organization and execution were top notch. It resulted in a very informative and a very enjoyable event. And I would conclude by saying that I participated in fourth edition also, and I was eagerly waiting for fifth edition. Now, since I have completed the fifth edition, I will be eagerly waiting to participate in the sixth edition also. Thank you for giving me an opportunity to present a paper also, and giving me an opportunity to present the feedback. Thank you, sir.
Okay. Thank you, Dr. Naranjan. If there is anyone else willing to give feedback, this is the time now. Dr. Mayank, would you like to give a feedback, sir?
Good evening, sir. Actually, this is a very informative conference, and I am attending BMSECON since second conference. So I have attended second, third, fourth, and fifth, and every time it doesn't disappoints. Although I would like to have more physiology talks, as I belong to physiology. Apart from that, this has been an excellent experience since the second conference. So there is no complaints in there. Thank you.
Thank you, Dr. Mayank. As we have been traveling for the last, 3-4 years, so it's good to see you, good to hear your feedback. Thank you. If no other feedbacks, we can move ahead in the session. Next, I would like to invite someone. A mentor is someone who allows you to see the hope inside yourself. This is a person who has mentored most of the people in our institute, and then to look deep inside ourselves and to carry hope and to grow along with our careers. I would like to invite Dr. V.N. Mahalakshmi, the Dean Health Profession Education of Arupade Vida Medical College, to share her feedback and her thoughts and notes on this 5th International Conference of BMSECON. Ma'am, over to you, ma'am.
Thank you, Frank. It's nice to see you all here, and nice to be part of this valedictory function. As most people who work with me know, like I'm a big fan of Steve Jobs, and I really like certain things what he has told. I'm reminded of the first time he introduced Macintosh, and it was a big event. The third generation Apple was introduced in a conference. So that time he was talking about how teams work. So he quoted the Beatles. He said, my model for working is about the Beatles. There were 4 guys. Each of them had their own distinct personalities, and all of them had their own quirks, right? I'm not sure many people in the audience know Beatles also, because they might have been born after the Beatles generation. But arguably they are the best band in the world. And he said these people kept each other on check, especially their negative tendencies. And the sum total of all their outputs was much, much better than their individual outputs. So that is what teams are all about. Individually, all of us contribute towards institutions, but as a team, we just not add up our contributions. We actually exponentially increase the outputs or outcomes which come from that. So when a team of people work together and then they bring about something nice and with a measurable outcome, then that becomes very inspiring, motivating for the others also. So once you get that critical mass of people, critical mass of events going, then it has a snowball effect. It keeps collecting more and more people. So I remember the first ever BMSECon which was done, and with so much difficulty and trying to figure out how to do many things. Now it looks like it runs like a very well-oiled machine. It just, people know that this is what Manju will tell. 1, 2, 3, 4, 5, we have to do these things. So that's how it goes. And the credit goes to the departments and the faculty members, and especially the junior staff who kept this event going. And you all have done a great job. Congratulations. Time to celebrate, and well done. Thank you.
Thank you, ma'am. Thank you so much for this lovely words from you, ma'am. I think who is better than you to talk about team building and the teams? Um, and thank you, ma'am. Now I'd also like to invite you, ma'am. Please remain here to give the results and announcements for the Best Young Research Scholar Awards by these two companies, ma'am. I'll be displaying the slides, ma'am. You can read out one by one.
Okay. Can you go on slideshow mode?
Yes, ma'am. And you can announce it.
Yeah. The Young Research Scholar Award. This is one of the most eagerly awaited sessions in the entire conference. For the faculty goes to Dr. Viveka. She's I hope it is she. It's an assistant professor from Department of Biochemistry, Velammal College, Madurai, for her study on investigating the association of nitric oxide and neutrophilia. Okay, so that is the neurotrophin 3 with cognitive function in schizophrenia spectrum disorder. Congratulations, Dr. Viveka. Frank, can you tell what is the award given to them?
I think the organizing secretary of the would tell us or the organizing chairperson would tell us what is the cash prize for it or the price about it. Ma'am, the faculty price is 8,000 rupees. And,
wow, that's very nice.
And the
and
PG,
a certificate.
And of course, a certificate. Now, the PG and PhD are 7,000 rupees, again with the certificate. And for the undergraduates, it's 5,000 rupees.
Okay, good.
Okay.
The next one. For the Young Research Scholar Award for Postgraduate goes to Dr. Kavya Sanak from the Department of Biochemistry, ESI Medical College, Faridabad, for the study on DHEAS and cortisol as a predictive marker for stillbirth, a case control study. Hey, this is also for biochemistry, 7,000 rupees. Okay. And for the PhD scholar, the Young Research Scholar Award goes to Dr. Shrishti Paul, Department of Anatomy, Integral Institute of Medical Sciences and Research, Faculty of Medicine and Health Sciences, Lucknow, for the study title, Comparative Study of Facial Height and Mental Index in Diabetic Subjects with Non-Diabetic Individuals. This is also carries a cash prize of 7,000 rupees. Congratulations, Dr. Shrishti. And the undergraduate prize for the Young Research Scholar Award goes to Mr. Shanmuga Sundaram, Department of Physiology, again from Velammal Medical College, for his study on the impact of breathing exercises on exhaled nitric oxide levels in bronchial asthma patients, an interventional study. This is from Physiology. And this carries a cash award of 5,000 rupees.
Thank you, ma'am.
Thank you, Frank.
Yes, ma'am. That's about the Young Research Scholar. Next, we will move on to the announcement of results in department-wise. To announce the results for the Department of Anatomy. Ma'am, please don't go, ma'am. Be here because that's why I've not yet thanked you. I would like to invite Soumya, ma'am, to announce the results for anatomy.
Thank you, sir. I'm happy to announce the winners of the scientific presentation under faculty category. Day 1, Hall 1, Session 1, Dr. Radhika PM from MS Ramaya Medical College. Day 1, Hall 1, Session 2, Mr. Delhi Raj from Meenakshi Academy of Higher Education and Research Institute, Chennai. Next, sir. Day 1, Hall 2, Session 1, Dr. Kudusia Sultana from Enapoya Medical College, Mangalore. Day 1, Hall 3, Session 1, Dr. Kalpana Ramachandran, Professor and Head from Sri Ramachandra Institute of Medical Science and Research Center, Port Road, Chennai. Next slide. Day 2, Hall 1, Session 1, Dr. Divya C, Professor from Enapoya Medical College, Mangalore. Day 2, Hall 2, Session 1, Dr. Rajakumaran T, Assistant Professor from the Velamal Medical College Hospital and Research Institute, Madurai. Next slide, sir. Day 2, Hall 2, Session 2, Dr. Joyce Vinodini, Department of Oral and Maxillofacial Pathology from Indira Gandhi Institute of Dental Science, Pondicherry. Next slide, sir. Day 2, Hall 3, Session 1, Dr. B. Sendil Kumar, Associate Professor from Vinaya Mission, Kribananda Variyar Medical College and Hospital, Salem. Day 3, Hall 1, Session 1, Dr. Shweta Swami, Professor from Kalpana Chawla Government Medical College. Next slide. Day 3, Hall 2, Dr. Priyanka Clementina Stephen from Bharat Medical College and Hospital. Day 3, Hall 3, Dr. Kavita M, Assistant Professor from Sri Ramachandra Institute of Higher Education and Research, Port Road, Chennai. Next slide. So yeah, I'm announcing the result of the postgraduate category. Day 1, Hall 2, Session 2, Dr. Rajshekhar Reddy from Mahavir Institute of Medical Science. Day 3, Hall 4, Session 1, Dr. Caroline Kritika, Department of Pathology, Arbore Veedu Medical College and Hospital, Puducherry. Winner list under PhD category. Day 2, Hall 1, Session 2, Dr. C.P. Kritika, PhD scholar from Sri Ramachandra Institute of Higher Education and Research Center, Port Road, Chennai. Thank you, sir.
Thank you, ma'am. For next, I would like to invite Dr. M. Gopinath, Professor and Head Department of Physiology, Arupade Veedu Medical College, to announce the results for the Department of Physiology. Sir, over to you.
Am I audible?
Yes, sir.
Yeah. I'm happy to announce the results of Department of Physiology. Yeah. It is faculty oral presentation. It is Dr. Srihari R, Assistant Professor, PSP Medical College, Hospital and Research Institute, Chennai, on the topic prevalence and effect of sleep compromise on cardiovascular health among school-going adolescents in Chennai. And it is oral presentation under postgraduate category. Dr. Vivek Shekhar from Sri Ramachandra Institute of Higher Education and Research Institute. Its topic is virtual reality simulation model, a cost-effective tool for enhancing performance running athletes. And next, under oral presentation PhD category, Mr. Kameshwaran Jaishankar from Dr. ALM PGIBMS, Madras University, on the topic therapeutic potential of statin on modern life stress induced PCOS. And under undergraduate e-post category, it goes to Mr. Rashik Ahmed, AM, belongs to second year MBBS student, Velamal Medical College and Hospital Research Institute, Madurai. His topic is on effect of intermittent fasting on cognitive skills in young adults. Congratulations to all the winners.
Thank you, sir. Next, I would like to invite Dr. R.R. Kumar, Assistant Professor, Department of Biochemistry, to announce the results for them.
Thank you, sir.
Thank you, sir.
So, am I audible, sir?
Yes, sir, you are.
So, I am very happy to announce the results for Biochemistry Department. The first one, the best oral presentation. For the faculty category, it goes to Dr. Deepak Ranjan, Senior Resident, Savita Medical College, Chennai. The topic is Diabetes Lipid Index as a novel tool for identifying cardiovascular risk in type 2 diabetes mellitus, a comparative study. The oral presentation for postgraduate category, it goes to Dr. Malavika from Savita Medical College. The topic is Association of Cardiometabolic Index with the lipid profile and the HbA1c levels in type 2 diabetes mellitus patients and controls. Congratulations, ma'am. So the oral presentation for the PhD scholar category goes to Mr. Rajkumar, Vinaya Missions Medical College, Karika. The topic is peptidyl arginine deaminase type 4 and rheumatoid arthritis in Telangana state. So the e-poster presentation for the undergraduate, it goes to Ms. Rakshita from Savita Medical College. The topic is exploring the alleviation effect of C. viscosa on streptozotocin-induced diabetes in pancreas of mice. Insights from gene expression. Congratulations to all the winners.
Thank you, sir. And that's about the results. So we have come to the closing ceremony of the valedictory function. We all know the smallest act of kindness is worth more than the grandest intentions. It would not be nice to let people know that we thank them for what they have done to us in a grandest manner. So now I welcome Dr. Elankadir, the organizing secretary for this 5th International E-Conference of BMSECON 2024, to deliver the vote of thanks. Sir, over to you.
Thank you, Dr. Frank. Good evening to one and all. First, I would like to thank the Almighty and the nature around us. On behalf of BMSECON 24, as the organizing secretary, I feel humbled to propose the vote of thanks today. First and foremost, I wholeheartedly thank our Honorable Chancellor, Dr. A.S. Ganesan Sir, Madam Chancellor, as well as President VMRF, Dr. Anuradha Ganesan Ma'am, for giving us this opportunity and support to conduct this conference. Thank you, sir and ma'am. Now I would like to extend our gratitude to Mr. Suresh Samuel, Member, Board of Management, for gracing the inaugural program and declaring our conference open, as well as releasing our e-souvenir. Thank you, sir. I would like to wholeheartedly thank our Honorable Vice Chancellor, Dr. P.K. Sudhir sir, who has supported us in organizing such a wonderful event. My heartfelt appreciation to our beloved Dean sir, Dr. Rafael Sehal, for his unconditional and overwhelming support and timely advice. My gratitude to our respected Dean HPE, Dr. V.N. Mahalakshmi ma'am, who has supported us with her timely advices. We thank you, ma'am. I thank our former Medical Research Director, Dr. B. Vishnubhat sir, who was always an integral part of our BMSECON conference. His help in getting our abstracts published in journals is worth a big applause. Thank you, sir. I would like to extend our sincere gratitude to Medical Superintendent Dr. K. Damodaran, Dr. Jay Singh, our VP Admin Dr. T. Rajan, VP Student Affairs Dr. Lakshmi Jatia, VP Academics Dr. Lata, Deputy Medical Superintendent Dr. Arunachalam, Deans of other medical colleges under VMRF, heads of various institutions of other colleges in ABMC campus, university officials, members of STB, HODs, faculty members, and students of ABMC. I also would like to thank our TNMC observer, Dr. T. Prasad, Professor, Community Medicine, for his support and cooperation for the last 3 days of our conference. Our conference was appreciated for its scientific talk and afternoon session presentation, the scientific presentations, and the whole credit goes to our outspoken, elegant, and knowledgeable resource persons, chairpersons, and the judges. All of them were so humble and cooperative that all our speakers, chairpersons, judges logged in before their allotted time, which was very much helpful for us in conducting the conference in a smoothly way and in time. The whole organizing team is grateful to you all, sir. Thank you. The conference wouldn't have been great success without our delegates. We thank you all the delegates for your overwhelming enthusiasm in attending the sessions as well as presenting your scientific papers. We had around 210 abstracts in various categories, and we were in need of many online platforms. I take this opportunity to extend my heartfelt special gratitude to people who are very much kind enough to help us by sharing their official online platform for conducting this conference. I thank our Deputy Director, AVIT, Dr. Rajasekhar sir, our own beloved Dean sir, Dr. Rakesh Sehal, Dean HP ma'am, Dr. V.N. Mahalakshmi ma'am. Thank you all for the warm gesture. I wholeheartedly thank all our sponsors for their financial support. I thank our virtual platform, event management team, meetings and more, who are there with us in minute-to-minute planning and execution of the program. Thanks a lot, especially to Pankaj sir, Zia, and Mr. Karthik, and all others in the team. I would like to thank our informatics department, Mrs. Vijay Chitra, Mr. Sam, who have designed the website, the BMSECON videos, and the promotional ads in social media, and all the mails that you have been receiving during the registration process. Thanks a lot. I thank our publishing and designing division, Mr. George and Mr. Kavi, for our brochures, conference proceedings, virtual backdrops, and banners. Thank you. The organizing team thanks Hotel Accord Puducherry, who has readily accepted to cooperate and provide us a venue in conducting the conference in a smooth fashion. And that too happened within minutes. A special thank to our accounts department, Mr. Ravichandran, and his team who have cooperated with us in managing the registration money. I thank all the supporting staff of all the administrative officers of ABMC for their timely help. Last but not the least, our vibrant organizing team. Each one of us have contributed and worked hands in hand for the success of this conference. I can proudly say the real success of our team was unity, a lot of tolerance and commitment to the work allotted. If I have missed anyone, I sincerely apologize, and it is not intentional. Thank you, one and all. I have a small announcement for the delegates. All your participant certificates, you can find it, you can download it from the link that will be shared to your registered mail, and also it will be shared in the WhatsApp group. Please give us some time. The paper presentation and the best paper certificates, all the certificates will be dispersed in another 1 week. So please kindly cooperate with us and give us some time. Please do not exit the WhatsApp group that we have created. We'll be sharing the list of delegates who have really applied for obtaining the TNMC credit hours. So stay with us. Thank you, one and all.
Thank you, sir. Thanks for that enhanced sense of gratitudeness from the deep down of the heart for this conference. I think that's the end of it. Now I'd like everyone to stand for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all. Signing off from the team, BMSECON 2024, our 5th International Conference. Thanks once again.
Thank you. Thank you so much, sir. Karthik, sir.
Thank you. Thank you. M&M team, thank you so much.
Thank you, ma'am. Thank you for the opportunity.
Thank you, Karthik, for being with us for all leading continuously.
Bearing
it's
our
just
irritation, our
no, it was
continuous
nothing like that.
pestering.
It was a team of 4 or 5 people, ma'am, not only me.
Yeah.
So
So that's
everybody
No,
was
we
there.
know. That's
Credit
what we
goes
told
to
the
the entire
team. We know
MI.
only 3-4 names. That's why we mentioned Pankaj sir, Zia, Karthik. We see 2-3 other names also.
In fact, Pankaj sir, the entire team is here. Miss Hansika, Mr. Aftab,
Hansika.